Hi, I'm Niamh, one of the chartered physiotherapists here at Peak Physio. Today I will be demonstrating a short sample of exercises to give you an idea of some of the types of things we include in our Clinical Pilates classes. While our classes can be targeted to a variety of different levels and abilities, this should hopefully just give you a little taster of the types of things you might expect to find coming to one of our Clinical Pilates classes. If you would like to know more about any of our Clinical Pilates classes here, then please contact our team. We'd be delighted to answer any questions that you might have. Let's begin with a sample warm-up. Beginning with our key elements, we want to make sure the back of the neck is nice and long. Collarbones open and wide, shoulders back and down. And as you gently breathe in and out, just imagine filling two balloons with air as we really expand down through those lower ribs. Chin stays tucked in. If you rest your thumb around the area of the belly button and fingers down towards the pelvis, you get a little diamond shape. Just warming up our lower back and pelvis, we're going to tilt that diamond gently towards the face, so the pelvis tilts backwards. And then tilt that diamond gently towards the feet, so the pelvis tilts forward. Just exploring what range you might have there, and just starting to get some movement going in the lower pelvis. And then we're going to settle in a comfortable mid position. We want to make sure the knees are nice and soft, gentle activation of our lower tummy muscles, and equal weight through the big toe, little toe, and the heel. Let's begin with our corkscrew exercise. We're going to inhale, take the arms up overhead, drop the hands behind the head, lift the shoulders, lower the shoulders, bring the hands up high and lower back down. Let's add the breathing here. Inhale, arms overhead, exhale to drop the hands behind. Inhale to shrug the shoulders, exhale to lower those shoulder blades back down. Inhale to raise the hands and exhale to lower. Let's continue here. Dropping the hands behind, lift those shoulders, lower back down, hands up tall and coming round. Shrug and lower, hands up tall and come back down. Let's take the arms up to waist level. Take a breath in here to prepare. As we exhale, we're going to open out through those arms, stretching that chest. Inhale to return. And exhale to fan out through the hands. And inhale to return. Exhale to fan. Inhale to return. Let's see if we can warm up the legs a little bit at the same time. So as we fan out, we're going to sink down into a little mini squat and rise back up as we return. Inhale, exhale, and inhale to return. Keeping that chest open, chin tucked in. Lovely. Let's move from here into a spine twist to start to get some movement going in that upper trunk. We'll cross the arms across the chest, chin tucked in, back the neck is long. Take a breath in to prepare, and then we're turning, beginning to go to our right hand side, and turning back to center. Inhale to prepare, exhale, coming over to that left hand side, and inhale to return. And continuing there. Imagine two headlights shining from those bony prominences at the front of your pelvis. So we're really concentrating on keeping that lower part of the trunk and body nice and stable as we're encouraging some nice gentle mobility through that upper body. And just one more each side. And from here, we'll work into our toy soldier. So we'll work through the movements first. Inhale to prepare. We're going to exhale, take our arms up to shoulder level. As we inhale to pause, on the next exhale we're going to lift one arm and at the same time lower the opposite arm. Inhale to return. Exhale, we're alternating here. We're focusing on rib placement, so we're really trying not to overextend the lower back here. We're trying to open up through the shoulders and dissociate the upper body from the lower body, so really gain some control. Now we're going to add a little bit of leg movement just for an extra challenge. So as we pick up the right arm, we're going to raise the left knee, and then we're going to alternate as we continue here. Still imagining that helium balloon attached to the crown of the head. And just to cue your lower body movement, imagine that those legs are between two mirrors and you're trying to keep a nice alignment through there. 3, 2, and 1. Next I'm going to show you a few standing exercises. We'll begin with the foot series. So feet hip distance apart, try and have equal weight through the big toe, little toe and heels, knees nice and soft, and a gentle engagement through those deep tummy muscles. We're going to begin by coming down into a half or mini squat position, shoulders slightly forward, and at the same time we're going to bring our hands out in front. From here then we're going to rise up onto the tiptoes, then lower back down onto the heels before extending back up tall. Now this one can be tricky on the balance, so do get support from a wall or support if you need to. So inhale to prepare, exhale coming down into the mini squat. Inhale to rise up onto the toes, exhale to lower, and inhale to come back up. Exhale to come back down. Lift, lower, and extend. Up on those toes, coming back down, and back up tall. Up on those toes, coming back down, and nice and tall. Keep going here. Next we'll move on to our scooter. Feet hip distance apart again. Engage those deep tummy muscles. So just begin by shifting your weight a little bit side to side, and then we're going to accept the weight onto that left leg. From here we're going to come down into a little mini bend, so that small squat again. Here we're stabilizing through the left leg while the right leg is going to slide forwards and slide back in a skating motion. Really sliding forward and sliding back, but at the same time focusing on the stability around that left hip and knee. And then let's alternate to the other side. So again, gently shifting the weight side to side. We're going to accept the weight through the right side this time. And gliding. A really nice one in terms of running and walking mechanics. We're going to begin with hundreds at level 1, which is a really nice foundation exercise. So just checking your posture in a lying position. We still want the back of the neck to be nice and long as your head is supported, collarbones wide, ribs just melted down into the mat. Again, use that pelvic diamond just to find that comfortable mid position and gently switch on those deep tummy muscles. From here we're going to start to add little pulses, just to gently challenge the abdominals. and those deep tummy muscles that we're looking to get firing. So we're going to aim to inhale for 5 pulses and exhale for 5 pulses. Just small little pulses, and we're looking to make sure that we're staying nice and relaxed through the neck and shoulders, and that we're not seeing any excessive doming through those lower tummy muscles. Knees should be nice and steady, just pointing up towards the ceiling. And we aim to continue those pulses until you've completed 100 pulses if possible. But just work at your own pace. One leg stretch, level 1. So this is a really nice exercise again for walking and running mechanics. We're going to set our center, gently engage those deep tummy muscles, staying nice and relaxed through the neck and shoulders. So we're going to slide the left leg down towards the end of the room, keeping that neutral spine, and slide back in. So take a breath in to prepare, then exhale to slide that foot down to the end, and inhale to return. Now sometimes it's helpful just to roll the end of the mat up while you do this one, just to reduce the friction because it can get caught in under the foot. And just return it back to normal afterwards. Inhale and exhale. Let's move over to the other side. So now we're keeping that left knee really still. Take a breath in to prepare and exhale to slide that right knee down to the end of the room. And inhale to return. As the leg slides out, really tune into those deep tummy muscles and make sure we're not losing that lovely neutral spine position as the leg extends. Keeping the neck and shoulders nice and relaxed. Inhale to return and exhale. Nice, easy breathing, expanding those lower ribs. So we're now in a side lying position. I'm going to introduce our Clam level 1, which is a really nice exercise some of you may be familiar with for strengthening the outside hip muscles, the gluteals. For some populations for this exercise, so some conditions and things, we place a ball between the knees for comfort or for just to add extra support where needed. For example, in osteoporosis, we pop a ball in there. So if you have one and you want to use that, that's fine. You can pop that between the knees or a pillow or rolled up towel. So just in terms of your setup position on your side, you want your head and neck supported, arm underneath you if that's comfortable. You can have the elbow bent, but if that's not comfortable on the shoulder, you can just support your head on the pillow as needed. We want a sense of space, just a little bit of a sense of space at our undermost side. So imagine just enough space for a stream of water or a little breath of air to pass through. And we do that by just gently lengthening our uppermost trunk and thinking about gently opening up through that upper part of the body. Our hips and knees are slightly bent so that the backs of our feet are just in line with the bottom, and our shoulders. For extra support, you can rest your fingertips on the front of the mat, and we want to make sure the head and neck are nice and relaxed. Find that neutral position again, even though you're on your side, and gently engage through those deep tummy muscles. We're going to take a breath in to prepare. Exhale, we're going to float that top knee up and outwards, and inhale to lower. Exhale to float, and inhale to lower. And we really just want to pay attention to our pelvic position, that it's staying at right angles to the mat, that we're not rocking backwards as the hip is opening up and out. Now everybody will have a different range available at the hip, so just work in the range that's available to you. You're many progressions for this. People often find this a really good challenge in the class as we work through the different stages. Just a couple more here. You might feel a little bit of a muscle ache, like it's worked at the end of that set. Let's come over and repeat on the other side. So we're going to set up just like we did on the other side, making sure the head and neck are nicely supported, shoulder stacked on shoulder, hip stacked on hip, knees and hips slightly bent, feet, hips and shoulders roughly in line. A little sense of space at our undermost side and nice lengthening through that uppermost trunk region. Set that neutral spine and engage those deep tummy muscles. Fingers resting on the front of the mat if needed. Inhale to prepare. Exhale, we're now opening up through that left hip. And where you should really feel it is on that outside hip muscle. So if you're feeling it on the inside of the hip, you might be just pushing that range a little bit too much. Inhale to prepare, exhale to float that knee and slowly lower. Lowering under control is a really nice challenge for that muscle group. The cool down can be a nice time to focus on stretch and mobility in the areas where we've worked. To begin with today, we're just going to stretch the arms up overhead, keeping the back nice and relaxed, everything melted down into the mat, and keeping the knees bent. I'm just getting a nice stretch through those shoulders and through that upper body, the upper part of the back. And we're just going to hold that position for about 20 seconds, a little bit more than that. Just taking nice easy breaths. The cool down is also a lovely time just to switch off and wind down. And coming back down slowly. Then we're going to stretch out the back of the leg. So holding the right thigh, hands just gently clasping behind. We're going to float that right foot up towards the ceiling and just hold for a nice stretch through the hamstrings. Everybody will have a different range here, so just work in your comfortable range. Nice easy breaths. And again, just taking the opportunity to unwind. Again, we want to hold this for 20 seconds or a little bit longer. And coming down nice and slowly. And we're going to repeat that on the left side. So just gently clasping behind that left thigh, floating that left foot up towards the ceiling. And feeling that nice stretch through the back of the leg. Keeping the rest of the body nice and relaxed into the mat. And nice easy breaths here. Again, we want to hold this for over 20 seconds. And once we've gotten between 20-30 seconds, nice gentle hold on there in your comfortable range. Just feeling a gentle stretch through the back of the leg. We draw the heel in and lower that leg slowly. Then we're going to go on just to stretch the buttock muscles that we worked earlier today. So we're going to cross the ankle over the opposite knee and gently opening out that hip, applying a small pressure just to push that right knee away from the body. For some, this might be a strong stretch through the buttock muscle, so you can keep that stretch just at that level. If you feel you need a stronger stretch, sometimes you can then lift that left leg away from the floor to get a stronger stretch through that hip and through those gluteal muscles. And again, we're looking to hold this for just about 20 to 30 seconds. Nice, easy breathing throughout. And lowering slowly. And repeating the same on the other side. So left ankle crossing the right knee, gently opening out through that left hip now. Feeling a nice stretch into the gluteal muscles around the hip and buttock. Keeping the back and shoulders, head and neck all relaxed on the mat. And then if you want a stronger stretch, or if you need to, lift that right thigh and draw in towards you. And again, holding for between 20 to 30 seconds as comfort allows. And lowering slowly. We hope that you found this taster helpful. Any questions at all, please feel free to contact the team at Peak Physio.